In deep flap breast reconstruction, or one of the main methods of autologous tissue reconstruction, tissue is removed from the abdomen and transferred or transplanted to the chest. The tissue is a segment of tissue that exists from an imaginary line, if you will, that exists from above the belly button, extending out to either hip bone, and then a lower line that exists just above the pubic hairline going out to either hip bone. You can imagine that tissue together having the shape of a canoe or a football or an ellipse. Either way, that tissue generally is cut in half, and the left side is transferred to the right breast and the right side is transferred to the left breast if someone is undergoing a bilateral breast reconstruction. Almost always, the tissue that is transferred is a little bit of skin and then all of the fat underneath that skin and the blood vessels associated with it. We generally try to leave behind all, if not almost all of the muscle underneath that in order to help a woman retain the integrity of their abdominal wall and core abdominal strength. Those tissues, the fat and the skin, are kept alive by a small blood vessel called the deep inferior epigastric perforator. And that blood vessel is disconnected from its source deeper in the pelvis and reconnected to blood vessels in the chest that exist on either side of the breastbone or the sternum. That process involves using microsurgery. So a microscope is used to connect blood vessels that have a diameter of 2 to 3 millimeters, so smaller or perhaps about the size of 1/8 of an inch or smaller than that. And when those blood vessels are disconnected, that tissue temporarily is no longer living, and the goal of the surgery is to make it living once again, if you will, through the blood flow through it by reconnecting to the blood vessels in the chest. This can be a very gratifying process because the ultimate breast that is reconstructed is comprised entirely of a patient's own tissue, and so it minimizes the potential for complications that can be associated with implant-based breast reconstruction. Frankly, I spoke erroneously. It doesn't minimize them, it makes them not even an issue. It's not to say that tissue-based reconstruction or deep flap-based breast reconstruction are not problem-free. It's just that they don't have the same problems that you can have with an implant-based method of breast reconstruction.